Today, you're going to learn that lower back pain or back pain, it's not just your spine problem. It's not just your disc problem. It's not just your sciatica problem. It's not just your degenerative disc disease or you lifted something wrong. There are many more other components and solutions that can help you for your lower back pain. I'm actually starting with a personal story that I had with a client. I had this gentleman in his 70s. He came for the first time to see me for shockwave therapy for his lower back pain. And I was actually looking his x-ray that was uploaded on our system before I saw the client. And I was going through the x-ray and I see this degenerative disease, herniated disc, L4, L5, protrusion, L3, L4, and honestly, fully loaded with labels, diagnosis, and the x-ray looked very bad. So I was expecting to walk in the waiting area to see somebody that is perhaps in a wheelchair, or they're using a walker or a cane and they cannot even walk. But instead, I saw this tall, perfect posture gentleman that he just stood up from sitting position like he had nothing wrong with him. And that's when I said to myself, and again, reconfirmed, because it's not the first time that I've seen that, that what you see sometimes in x-ray and what is shows sometime in MRI, it doesn't necessarily mean that that's your cause of your pain. Anytime when you take picture of the internal body, obviously you're going to see physical changes, because that's the goal in the end of the day of an MRI and x-ray, to see if there is any physical damage, if there is any structural damage. But x-ray, MRI, ultrasound does not show or cannot assess if there is a dysfunction in the area. Like, there is no assessment yet to see or to do MRI in motion, or to do x-ray in motion, or to do ultrasound in motion. When you're walking, what's happening to that area? What is pinching? What is pulling? So therefore, we take those in consideration, but we have to look at you as a human, as a functional mechanism, as a dynamic structure, not just the one little piece. So if you're somebody that you have been diagnosed with protrusion or herniated disc, or like pretty much you name it, and you have tried everything and then you're still in pain, perhaps your problem is not that, it's something else. So what I personally look for, and I have been forced to think this way because I deal with cases or people that have been in pain for minimum 3 months and have tried everything else. So when a client comes to UnPain Clinic, we have to sit and see, okay, you have tried physiotherapy, you have tried acupuncture, you have tried massage therapy, you have tried chiropractic for lower back pain, you have tried exercises, but nothing has solved the problem yet. So now we have to sit and try to put the puzzle together. Okay, what is the missing link here? So the first criteria that I go and check is, I ask if you ever had any surgery from the time you're born to today. If I see it on chart, or some people think that that's not relevant at all because they had appendectomy when they were 5 years old, and now they are 50 years old and they're complaining about lower back pain and they have no clue why. In reality, that's where the cause started. That's where the dysfunction started. But when you're younger, you can compensate much easier. As you get older, as you get more injuries, and please, I want to correct myself here. Being older, it doesn't mean that you have to be in more pain. It means that your biology is working properly. You're actually aging. You have a good biology. A dysfunction, a compensation, it doesn't matter how old you are, it's a dysfunction. Whether you're 93 or 20, you have the same muscle dysfunction. So going back to the appendectomy, when that surgery is done, there is a physical cut of the skin, which damages the nerve endings. You probably still don't have any feeling in that area. There is a physical cut of the fascia, of the muscle. And imagine if those muscles, those core muscles that stabilize your pretty much your whole body, it's the whole trunk area, including your lower back, they become dysfunctional, where that impact of your sports, of jumping, of sitting, it's going to go. It's going to end up on your lower back. And obviously, when you're 50 now, yes, we're going to see disc problems. We're going to see changes in the structure, because normally your vertebrae, your spine, it's a structure that protects one of your most valuable organs or tissue, is the spinal cord. So it cannot be a weak protection, because it's a vital system. So for that reason, your body, like spinal cord, is not superficial that you can just like scratch it somewhere and cut it. It's very deep. It's protected by bone, by muscle, by tissue, by structure. But what happens with time, you're going to constantly put pressure. Obviously, it's going to wear it out, because your core muscle did not do the work. Let's say you're a person, or you know somebody that never had any surgery in their body, but they have chronic lower back pain, and they haven't done anything. They don't do sports, they don't do any activities. So in terms of possibilities from external factors to injure them, they're very minimal, but they still have lower back pain. The next thing that we have to look is your bowels, your gut. If you have IBS, if you have any gut problem with digestion and inflammation, that actually can cause lower back pain, because your bowels sit in front of your spine, and they go almost like back on the sacral area. So what happens is, when you get constipated, and that inflammation actually builds up, and you already have some dysfunction on the SI joints, or like lower back area, now that inflammation is going to irritate that spot, and it's going to give you more pain. So it's not necessary that the cause, it's something wrong in the lower back. It's just anything that is happening with your abdomen in the front can cause lower back pain. So as a tip, I tell people, make sure to have proper digestion. I've read on books and science that magnesium, it's a good mineral that helps to release constipation, because it loosens up the bowels. So probably check or consult somebody in magnesium levels, or your doctors, and see if that's the case. And if none of them apply to you, but you're somebody that you were using a snowmobile, let's say, or you were water skiing and you just landed, or you were doing any kind of sport, running, and you landed on pretty much on your butt, and you have injured your lower back, or you were lifting something, and I'm going to talk about the lifting so later on, but more about physical injuries, that's a different story. If you cause a trauma in the whole lower back area, it's not just the spine, it's pretty much the whole pelvic that is jammed. Soft tissues are traumatized, because if soft tissues are designed to move our body, but also they absorb the impacts, the energies. So when the soft tissues are not doing the work, first, they're not moving your joint properly. Second, if they're super tight, they become more rigid. And then any impact that your body is exposed to, it's going to be transmitted to bones much easier, because when muscles are a little bit more relaxed, they can absorb more vibration and impacts. If they're super tight, rigid, then that impact will be transmitted to the joint. And that's how the joints are worn out, whether it's your knee, whether it's your hip, your lower back, and then we have those joints in between each disc. So it's the same mechanism. So that's completely different story. But if you got lower back pain because you were just lifting something, that's a completely different story. Why? Let's say you do a deadlift, and if your core it's responding properly, if all your big muscles are responding properly, that impact must go on the muscles, must not end up in the joint. But when those muscles are not balanced, when those muscles are dysfunctional because you had some kind of surgery or you rolled your ankle, and that ankle injury that you had years ago force you to function differently. Now, even when you're working out, I don't care how big your muscles are, because that doesn't mean anything. Like, we all have our 0 point. We all have our natural strength, and we are all meant to be functional without any pain. So being an athlete versus somebody that doesn't do anything, when it comes to dysfunction, doesn't really matter. You can be a super athlete, you can do lift all kind of stuff, but you're lifting and you're functioning in dysfunctional mode. So that's when I see bodybuilders injuring their lower back, because the core muscle, the lat muscle, the quadriceps, hamstring, all these large muscles of the body that are designed to handle that load, they're not working in synchronicity. They're not working together. Therefore, all that impact goes and can injure your lower back. So what are now the solutions? So the first thing, every time when you have a lower back pain, you can try to do some stretching, gentle stretching. But regardless what stage of lower back pain you are, and you're looking for lower back pain relief, the first thing that you do, whether you're in acute phase or in chronic phase, it's breathing. You have to practice breathing exercises for lower back pain. Why? Typically, when the core becomes dysfunctional, now your back muscles, the QL muscles, they stabilize your lower back, and what we call it the extensors muscles of the back. So now, as soon as the big muscle becomes dysfunctional, the small muscles will take over. They will tighten up to overstability. The next big muscle that helps in the overall stability is your diaphragm. Diaphragm, it's this big muscle that separates your lungs from your abdomen. And if you remember as a kid, if you were just running too fast and you got some like deep pinching sensation on the right side or left side, that's your diaphragm overworking. That kind of catches your breath and stops you. So that's diaphragm. So the moment that body is asking for stability, it will go and contracts the diaphragm. So the diaphragm goes more in spasm, which means you're not taking a very deep breath, which indirectly now causes more muscle tension, because less oxygen in the body, more muscle tightness in the body. And you have to remember that if there's less oxygen in the system, it's not going to go to your muscles first. It's going to go to the brain. It's going to go to the organs. So therefore, breathing is critical when you have lower back spasms or pain or whatever stage you are. And the other thing from a muscle component or compensation is that diaphragm, those QL muscles, and your hip flexors, your psoas muscles, they all attach pretty much together. So if one goes in spasm, it's going to make others to go in spasm. And if you want to just research a little bit, psoas muscles, hip flexors muscles, you see these two big, huge muscles that go from your pretty much T12, L1 to the L5. They attach there, and then they go behind the bowels and they attach in front of your hip. So when you sit, those muscles get super short. And if you've seen already a therapist for your lower back pain, then they're going to blame those hip flexors. They're going to give you stretching for the hip flexors, because when they get short and contracted, then they're going to compress all the lumbar spine area. After you have improved your breathing and you have tried the breathing exercises and techniques, and honestly, nowadays you can check on your on YouTube for breathing exercises for lower back pain, and there are a lot. So if you still continue to have lower back pain, then look at for a massage therapist. See if they can help you, if they can give you a guidance. And if a massage therapist and massage therapy for lower back pain specifically does not help your pain still, then you have to consult pretty much with your doctor, or look at a physiotherapist that specializes in lower back pain. Or most of chiropractors, they are really good when it comes to lower back pain. So you can try those. And if they help you, great. That's amazing. It was just almost like a glitch in the system. They helped you. That's awesome. But if you're somebody that you already have tried all those modalities and nothing has helped, then you have to look at, you kind of think yourself, okay, do I have gut issues? Do I have IBS? Do I have constipation? Like, look at that aspect of your body. Check your stress level, because when you're stressed, you're not going to breathe as well. You're going to breathe very shallow, and then it's going to affect you from that perspective that I just explained: diaphragm, hip flexors, QL muscles, and that could be one reason. And if those are all good and you still have a problem, it means that the problem could be now, or the compensation could be more with the deeper structures. So those are cases where we come in, or wherever you are around the world, look for shockwave therapy for lower back treatment. And what shockwave therapy would do in this case, it would shoot with sound waves. So it would break down scar tissues, adhesions that have been built up, probably from sitting, from different factors. And then it would reach 12.5 centimeters deep in your body. So it will go to places where normally we cannot reach by hand, or with IMS needles, or dry needling, or pretty much no other modality would be able to go that deep in the body to break down physically the scar tissues, adhesions, and to stimulate regeneration. So typically with shockwave, 3 to 5 sessions are more than enough to get things going. And how we do shockwave for lower back is we have to go and treat both sides, both of your hips, the whole lower back. We cannot just go and treat the area where you're experiencing the pain, because now when you want to influence changes and to reach balance in the whole lower back region, you have to treat your hip muscles, because on the hip muscle there, or on the glute muscle, there's a small muscle called piriformis. And that muscle, when it gets super tight, it compresses the sciatic nerve. So sometimes when you have a sciatic nerve pain, it's not necessary that it's only coming from the nerve root, from the spine, from the vertebra, or from the disc. It could be pinched from the piriformis muscle. So therefore, we must release that muscle. And by releasing that muscle, because it attaches on the end of your sacrum and on the hip, it actually adjusts your sacrum. So your sacrum is the foundation. It's the base for the lumbar spine. So imagine if we look at the body, on the top, we have very small spine, because we need more fine movements on the neck. As it goes lower, because again, now forces of the body are higher, body has adopted and created those strong structures. The lumbar spine are bigger, but then they don't move as much as on the top part. And then the sacrum, it's more fixated because that's the base, that's the foundation. So if foundation is off because those glute muscles that attach on the sacrum, they're pulling in different directions, then the problem stems there. So therefore, doesn't matter what kind of treatment you have, look for therapists that treats your dysfunction. They don't really focus on labeling. I know as a humans, we like to have a label. We like to get diagnosed. And once you get diagnosed, you're happy. But then you realize you got the diagnosis, but there's no solution. So therefore, don't focus much on the names. Focus and feel what is working for you, which therapist is helping you the most, which modality is helping you the most, and keep looking in that direction. And that's how you end up with a solution of a lower back pain, or especially chronic lower back pain. Okay, so then the next thing is where you go and work more closer to the spine area. I'm personally not fan of cortisone shots, injections that block pain for chronic lower back pain, because they're just treating the symptom. They're just trying to stop your pain, but they're not treating the dysfunction. And you have to remember that your body, it's one single system. If you stop the alarm, the signal in the lower back region, you force that, and your doctor is able to do that, that's great. But then that pain, that dysfunction is going to move elsewhere. Your body's not going to stop telling you that something is wrong in the system and I need help until you correct that. Okay, so it's hard to find therapists like that, but you have, if you want to feel better, if you want to get better, you have to take things in your hand. If you expect from a medical system to help you, it's never going to happen. And the main reason is that our medical system, doesn't matter where in the world, it's designed more to look for structural damage. So we see a problem here, okay, let's try to fix that. But when it comes to the dysfunction, it means in dysfunction, it's your life, you know, your mindset, your activities, your food, your habits, and all of that, plus aggravating factors and physical changes that happen. So therefore, I say the best doctor to help yourself, it's you. I truly hope that this helped you in a way just to have a different perspective and mindset towards lower back pains. If you're in need, wherever you're in the world, it doesn't matter that you're not from Canada or you're not from Edmonton. We truly want to help you. At UnPain Clinic website, we have a free telehealth session, 15 minutes. So just get into that. Let's see if we can help you. And we have a big network of people that we know, of practitioners like minded. So we can at least guide you to go at the proper place and have the proper technique. But if you're lucky, if you're from Edmonton, you have UnPain, or from Alberta, we constantly get people that drive 6-8 hours just for one session, then they go back. And typically with Shockwave therapy, it's only 3 sessions, 3 to 5 sessions, and then hopefully we never see you again. So I want you to be at the next podcast episode to listen to the next condition that we're going to cover. I don't know yet which one will be, but thank you for your time. And I truly hope that this helped you or somebody that you know that is experiencing lower back pain to look into those things. Thank you. Have a great day.